Good afternoon, everyone. It is 1 p.m. Central Time, 2 p.m. Eastern Time on my computer. So without further ado, we will get started. You are at the Direct Certification Virtual Training today, so hopefully you are in the right place. And just a few housekeeping reminders. If you have any questions during this presentation, please drop those questions in the chat and we will address them as we find time. And also just a reminder about the AI tools. The state of Tennessee does not currently permit the use of generative AI tools such as Otter in meetings hosted on state resources. Meetings with contractors, vendors, and subrecipients are not public meetings and may involve discussion of protected state data. The generative AI tools are not adequately regulated and are designed to train on data that is collected and may misrepresent data or release protected data to the general public. While the state supports your desire to maintain documentation of the meeting and what you learn, please respect our decision to safeguard information and do not attempt to use tools such as these. If you choose to use these tools, we will block those tools from the meeting. So if you have any AIs that pop up in the chat, we will disable them on our side, and then we will remove them from the meeting if we see them in our attendees list. So just a reminder there. And if you have any audio issues currently, you may have to leave the meeting and rejoin. But other than that, I will pass it off to Randa Mead for the direct certification training.
Good afternoon, everyone. I am Randa Mead. I am the Senior Compliance and Data Manager for the School Nutrition Program. Today, I will be going over direct certification. Before we dive in, I just want to kind of give you a little bit of what today is going to be about. So I have this direct certification PowerPoint. It's a very high-level PowerPoint that I shared at the attendance conference a few months ago. So we'll talk a little bit more in depth about some things that aren't on the slides, and I have some additional information I want to share. I want to go over our direct certification website, which includes ED guidance. It has file layouts for our direct certification data. We have the county code list, and I think I already said ED guidance and the eligibility manual. So for those of you that were in attendance on the quarterly update call, the breakout session, I did confirm with everyone that we are in the process of working on a request for proposal where we will hopefully have a new statewide system that you can utilize for direct certification matching. So I think I talked about that last year at S&P Academy. That we are currently using our legacy system, but I do want you all to know that we are working very diligently and very hard in order to get an RFP out and to get a new system for you all to use. It is one of our top goals for the year, if not our number one goal. And we have very good support from upper level leadership at the department. So we're very excited about this, and I just want to put that out there before we dive into direct certification of kind of where we are at the moment. So I'm going to go ahead and get into this presentation. So our mission statement is to develop extraordinary school nutrition professionals and provide strategies to increase consumption of healthy school meals. Even though I already talked a little bit about the agenda, the official agenda for today is we're going to talk about eligibility for school meals, the 30-day carryover period. We're going to review the direct certification process, direct certification data sources and flow. We're going to talk about the school nutrition benefit hierarchy, how direct certification relates to the economically disadvantaged category, and then also confidentiality of information. So let's start with a high-level overview of the eligibility for school meals. Y'all know this information, but we can't talk about direct certification without first talking about why we initially do direct certification in the first place. So, as we know, each year USDA provides updated income eligibility guidelines that we use to determine eligibility for free and reduced price meals. Income guidelines are effective from July 1 to the following June 30th. Households that have an income up to 130% of the federal poverty level are eligible for free meals. Households that have an income between 130 and 185% of the federal poverty level are eligible for reduced price meals. And I have linked the eligibility manual on this slide as a resource. I will throw it in the chat in a little bit when I get over to my browser and go through the resources that are on our webpage. So, as you know, to qualify for school meals, each year families are required to submit a household application for free and reduced price school meals. The local school nutrition team processes the application to determine if a child is eligible for free or reduced price meals. So, for the duration of eligibility, once an eligibility determination is made, a child's eligibility status remains in effect for the remainder of the school year. At the start of the following school year, children retain their previous year's eligibility for 30 operating days or until a new determination is made, whichever comes first. And determinations are made via approval or denial of a household application for meal benefits or via direct certification. Now, I know you guys are very familiar with this 30-day carryover period. But one thing that we discovered in the last couple of years is that some of your attendance folks or other people in your district were maybe less familiar with that. And they were utilizing the eligibility of a 30-day carryover for like official coding, economically disadvantaged, that sort of thing. And so we wanted to make sure that we clarified with y'all, as we've clarified with them, that eligibility based on the 30-day carryover is temporary and should not be included in counts of economically disadvantaged students. So I know that each of your districts is set up very differently. Some of y'all are doing attendance coding for the districts. Others are making the matches, sharing that out. So we just wanted to make sure that you are aware of how that requirement is. So if you get questions from your district or you're the one in charge of it, that you can have some, hopefully, control to make sure it's being done correctly. So for extended eligibility, if one child or adult in the household is eligible for free or reduced price meals based on a household application or participation in an assistance program, SNAP, TANF, or Medicaid, those meal benefits are extended to all children in the household. If a child is eligible for free meals by being identified as foster, homeless, migrant, or runaway, the eligibility is not extended to all children in the household. And then for those sites that are operating CEP, the community eligibility provision, we know that that's where students eat. All students eat at no cost. And sites operating CEP are not allowed to use school nutrition funds to process household applications. This was a question that actually came up on our DC breakout of the quarterly update call regarding if we were going to issue a household survey to get income information. And that's not something that we had previously talked about, but since it was asked a couple weeks ago on that call, we are looking into the possibility of it. So that's not a definite we're going to, but that's also not a definite we're not going to. I do know that there are some similar resources available online from other states that if your district is interested in using one or wants to use one, that would probably be the quickest way to move forward with that. Because like I said, we haven't definitively decided if we'll be creating one. And if we do, it has a decent process to go through before it can be approved and shared. Okay, so let's talk about direct certification as a process. So direct certification is a process that allows school food authorities and or local education agencies to certify children as eligible for free or reduced price meal benefits utilizing data from other means tested programs, eliminating the need for an application. And I've talked about this extensively with y'all over the last year or so that prior to our uh, participation in the Medicaid demonstration project, we really utilized direct certification to talk about a type of eligibility instead of using it like in this example, it is a process. And so as we move more into having that Medicaid data, especially the world that we're living in currently with our data being so important for economically disadvantaged, it is very important that we continue to remember that direct certification is a process. Direct certification is not a status or a code or anything like that that should be utilized when we're talking about children and their eligibility status. So if you take nothing else away from today, please take away the fact that direct certification is a process that we use to provide benefits. That is a very important key distinction that I really hope we work to change our vocabulary around. And then as we have learned over the last couple of years, direct certification and the J code were not the same thing, very much related to my last topic. I know the J code is gone, but that nomenclature still kind of lingers in our vocabulary. So I think it's still relevant to say direct certification and J code were not the same thing. Just like direct certification and economically disadvantaged are not the same thing. And I have more information on that in a few slides. So direct certification as a process. Data is sent from partner agencies to us at TDOE, the school nutrition team, and then we make that data available for you at the local level. You make your matches, and the child receives benefits. That's how our process works. We also know that after these matches are made, there could be a couple little arrows that go off from it that our data is used for other purposes. And we'll talk about that a little bit more too. So for our source data, first we have the Department of Human Services. So we receive information regarding participation in SNAP and TANF from DHS. And TANF, which is Temporary Assistance for Needy Families, is known as Families First in Tennessee. So participation in one of these programs confers automatic eligibility for free meals, and we receive data from DHS weekly. So I recently had a question to say, how do I know who's eligible for TANF and who is eligible for SNAP? So I'm going to go ahead and actually go over to our website. First off, this is our S&P resources, which y'all should hopefully are familiar with. But if you go to S&P resources and then you go to eligibility guidance, we have a subsection called direct certification process. So I'm going to put the link for that, for the direct certification process. It's got a lot of information just about direct certification in general, and then we have some additional resources over here. Specifically, what I want to go to first is the data download file layouts. And if I click the right button, this says state letterhead, but it is the file layout that I have showing on my screen. So when you download data out of TMAC, you have the option to do it as a text file, a CSV file, or an Excel file, depending on what you need for your district and your local software system. But when you download the data, it is in a very specific order, and each piece on that file is in a certain place and has a certain meaning to it. So for your SNAP and TANF file, when you download it, there's two columns that either have a Y or an N. So when you get to, if you're on the text file, it's at position 189 and it is one length because it's only a Y or an N. So if the child on that line is eligible for SNAP, there will be a Y and then there will be an N for TANF. And then if the child is eligible for TANF, in the SNAP column, there will be an N, and in the TANF column, there will be a Y. If the child receives both SNAP and TANF benefits, the child will appear on the list twice. They will have one Y for SNAP and they will have one Y for TANF. So that is how you determine which of those programs a child is eligible for. There's also a file layout for the DCS, which is foster, TennCare, which is Medicaid, and then for our northern counties that get data shared with Kentucky, there's also a file available for that. For Medicaid, there is a column that has MF and MR, or MF or MR. If it says MF, the child is eligible for free benefits. If it's MR, the child is eligible for reduced benefits. So we can come back to this, but I do know that that was a recent question regarding SNAP and TANF, so I wanted to divert here for a moment. So there's been a lot of conversation about SNAP data, DHS data. When do we get it? The emails are confusing. I'm sorry, I understand that. But we're really trying to not explode your email with an email every single week to say, hey, we have SNAP data. Hey, we have SNAP data. So for school year 25-26, we got a July 1 file, just like we did last year. The July 1 file, so it has an effective date of July 1. That is our big file, our cumulative file where we get every student who is currently eligible for SNAP or TANF benefits. We also receive data on a weekly basis, and each of those files we receive from DHS has a different effective date. And those effective dates are for Fridays of the month. So for example, the dates of the July files are July 1st, July 4th, July 11th, July 18th, and July 25th. I know some of you have inquired about making matches more often, or you want to wait until we send the email to download the data. We will send an email when the data for the full month is there and complete. You can download data more frequently. You can make matches more frequently if that works for you and your system. I've also heard some concerns that you're worried that if you download the data before you get the email that you'll miss one or something like that. If you're downloading it weekly, you won't miss. You can double check that all of the dates are there. And I promise you guys that if there is something wrong with the data that you need to not download it or something happened and you need to re-download it, we will absolutely communicate that. So if you want to download more frequently, you can. If you want to wait until that email we send, you can do that as well. That email says, hey, we've got all the data for the prior month for SNAP, since we get that on a weekly basis. and then we've received the upcoming month for Medicaid. So that's how those emails work. I'm sorry it's a little confusing, but we think that's the best way to not implode your inboxes with weekly emails that we're uploading data. We are receiving it and uploading it on a regular basis. Like I said, if something happens that we don't, we'll definitely let you know. So their next source data is TennCare. TennCare utilizes information received on Medicaid applications to determine if a household is eligible for free or reduced price meals. Participation in Medicaid does not automatically confer eligibility to the school meals program. Some individuals or households can receive Medicaid benefits with an income greater than 185% of the poverty level. And again, we get TennCare data monthly. So if you think back to those first slides where we talked about what it takes to be eligible for the school nutrition program, for SNAP and TANF, it is more difficult to qualify for those than the school nutrition program. So if someone is receiving those benefits, it automatically means they would qualify for school nutrition. And that's why everyone who has SNAP benefits is eligible for school meals. We've had questions over the past couple of years that say, hey, I know this student receives Medicaid. I can't find them on the list. Why can I not find them on the list? And it's very likely that it could be this type of situation where the family or the child is receiving Medicaid, but they might be receiving Medicaid because they have some type of special condition or some other circumstance where their income is actually greater than what the poverty level is, and they're still receiving Medicaid benefits, but they're not actually eligible for our program. So if you know that a student is receiving Medicaid and they're not on the Medicaid list, that doesn't necessarily mean that it's broken or it's not working. They just may not truly be eligible for our program. So I have a question that says, is it best to upload on Monday for the previous week to make sure we capture it? So if you're downloading weekly, there's not an option to only download 1 week at a time. You're going to always download the full month. And I can't really say what's best to do because it depends on your local point of sale system. It depends on your local capacity. There's a lot of factors that go into that. So I can't say which way is best, but I just want everyone to know that if you choose to do that, it is acceptable. It is also totally acceptable to wait until the end of the month when we get that email or when you get that email. That's the main thing that I want y'all to be aware of. What if a child is on the list for Medicaid, but the child does not have a medical card? The parents have let us know, but they pull on the list for Medicaid. If you are certain that that is a match, the benefit is there. The parent does not have to accept the benefit though. They can decline the benefit if they don't want to accept it. Okay. So our next source of data is the Department of Children's Services. So DCS provides a list of students who have entered into foster care. A foster child is a child whose care and placement is the responsibility of a state or welfare agency and who is placed with a caretaker household by the court. The foster definition only applies to foster children who are formally placed by the state welfare agency or court and does not apply to informal arrangements. This is really important when you're dealing with your local families because grandma might take a kid or something like that and think that that means they're in foster care. That does not necessarily meet the formal definition. And that's why it's really important if you're providing benefits based on direct certification that you either get the child's name off the list or you have the local data and support to back that up through your local foster liaison. So we have a question in the chat about how do I handle migrant applications? Several applications have checked migrant enlisted income. I don't know if that's becoming a widespread thing that you're seeing. Um, we typically don't see a lot of those, and I have to look it up in the eligibility manual every time. I don't have that committed to memory. So if we have time at the end, we can reference and I have migrant up here, but we'll talk about what that means on an application if we have time at the end. And if not, I will follow up with you. Let me make a note to put that on the follow-up for migrant applications. Okay, so then we also have other source categorical eligibility. So homeless child is identified as lacking a fixed, regular, and adequate nighttime residence under the McKinney-Vento Homeless Assistance Act or as residing in a homeless shelter. A migrant child is identified by the local educational liaison when he or she meets the definition found in Section 1309 of the Elementary and Secondary Education Act. And then runaway child is identified by the local education liaison through a program under the Runaway and Homeless Youth Act. So for migrant, I know if they check that on the application, it is not accepted at face value. And where this says is identified by the local education liaison, that information would have to be confirmed. Regarding though the piece about the income, that's why I'm like, I'll get back to you and double check on that. And then we have a comment that says some of my parents think migrant means immigrant. Yeah, I can see that being confusing, but migrant does have a very specific definition when it comes to eligibility for the school nutrition program. So other source categorical eligibility, we have foster, is a child whose care and placement is, again, the responsibility of the state or local welfare agency or is placed by a court order with a caretaker household. So this is foster when it's locally identified. Again, you need to have that supporting documentation for it to be considered a direct certification, that educational passport or whatever that may be. And then Head Start or Even Start is also a option for direct certification that can be other categorically eligible. And then, like I said earlier, we get new lists of eligibility from each partner agency as of each July 1st. So I know that has been a big change in the recent years, but July 1 is the big list, the new list, where we have all the students who are currently eligible for the program. They appear on the July 1 file. Every file that we get after that are children who have become eligible since the last time we have received a file from our partnering agency. Okay, so what is required for a direct certification match? Now, this is directly from the eligibility manual. But names of children or household members currently certified to receive benefits. So you have to have at least one additional piece of identifying information to match the enrolled to the student to the data source. So that can include the child's birth date, the address, parent or guardian names. Again, this comes directly from the eligibility manual, so it still says social security number if available, and then gender is another way of making a match. There's a lot of information we could get into on the actual matching process, but it is so different for each of your local systems depending on what software you have or not. I will say, if possible, it is a best practice to match against all data every month. So I know some of your systems are able to kind of store that data for reference and make matches. Some of you have to upload all of those data files every single month, which is very painstaking and time consuming. I'm very aware of that. That is another reason we are working on an RFP to hopefully, or no, not hopefully, we are going to get a better system in place. Okay, so let's talk about the school meal benefit hierarchy. The hierarchy for providing school meal benefits is implemented as follows. So first is SNAP, then we have TANF, then we have all the other source categorically eligible. There's not any one of those programs that is ranked higher than the other. They're all just kind of tied right there for number 3. Then we have Medicaid free, free by application, Medicaid reduced, and reduced by application. Which brings us to talk about economically disadvantaged. I do see a question that says, will additional identifiers be added, especially since we don't collect Social Security? And I'm interested in what additional identifiers you might be looking for. So at this time, there's no definitive plans to add additional data. There are potentials depending on what happens with our RFP process to potentially add more data if it's available from our partner agencies and if you have that locally. So I'm open to hearing and talking about what that might look like for all of you, because I want us to be able to help you make the most matches as possible. And then there's a question, Marlia responded in the chat, but you will get a copy of the presentation and a recording as well. So, economically disadvantaged. The economically disadvantaged subgroup for assessment, accountability, and TISA is defined in law and Tennessee's Every Student Succeeds Act, or ESSA plan, as a student identified as experiencing homelessness, foster care, unaccompanied youth, or migrant status, or a student meeting the direct certification eligibility guidelines pursuant to this U.S. code, which is SNAP and TANF. Now, I know the words direct certification in this definition can be very confusing, but that's why we don't use it to talk about a status. That's why direct certification is a process. And for us, the economically disadvantaged subgroup does include SNAP and TANF, does not include Medicaid free or reduced. Which brings me to back here to the SMP direct certification process information on our website. We have this economically disadvantaged guidance. This has been updated for this school year. It has the hierarchy like we discussed. Talks about again, the official definition of economically disadvantaged. It has new for this school year 25-26 that we have retired the J code, and SNAP and TANF eligibility now receives its own coding. So the ED subgroup includes students directly certified to receive free meals via participation in SNAP. Those are coded SN. Students directly certified to receive free meals via receipt of TANF benefits. That's coded TO. And then you have foster, which is FOSO1. Homeless gets an H. Migrant gets an I. Runaway gets a U. Students with extended eligibility via SNAP or TANF also are included in the economically disadvantaged subgroup. I just had a very important thought while I was reading this and it went away. Let me go over to the chat. Okay, so really good question. It says, are extended SNAP benefits a higher priority than TANF direct matches? And I would say yes, because that child technically has been certified and identified as SNAP, because theoretically, if they're in the same household, the SNAP and the TANF, I would imagine, go both ways via extended, but the SNAP would get the higher priority. And then I see we are hoping to have state ID. And that is definitely something that is on our radar for the RFP that we're doing. One of the issues with the state ID is that it does still require some type of matching, because none of the source data that we receive has a state education ID. So I understand that it would be important or useful, helpful to be able to have that state ID to look up to see if you can see that student. But we can't take the state student ID and use it to actually match to another data set, because that state student ID does not exist in the other data sets. So when we get information from Medicaid, we get a Medicaid case number. When we get information from DHS, we get a SNAP or TANF case number. So it's kind of like two totally different identifying numbers. But that is definitely still on our radar, and there are potential ways that that could be used for matching. We have also added oh, I know what I was going to say with all of these codes before I go to X and Y. I've had a couple of questions about the codes and if that needs to show up like at your local point of sale system or in your local cafeteria. And the answer to that is no. When you're having kids go through the line and marking them off, I mean, you typically have something that would indicate free or reduced, but having all of these codes at that very granular level is not necessary. Again, it really depends on how your system works and how things are set up in your district as to how that will look. But the important thing that you know when kids get a meal is if they are free, reduced, or paid, so that you can claim the meal accordingly. We have also added X and Y codes, which are free and reduced eligible via application. These are optional, but X is to be used for free meals via application, or Y would be the student is eligible for reduced price meals via application. Again, those are optional. And if you have CEP schools, the schools that are CEP would not have the X and Y codes due to not accepting applications. I do know in some mixed districts, it might be a little bit different. And that's some of the things that we're still working out as far as their guidance and our expectations. But there are X and Y codes. They are optional this year. And if you have more questions about those, we can talk about them outside of the direct certification conversation. I'm going to get a drink of water. Okay, so again, back to the PowerPoint, basically saying the exact same thing that I just talked about in that handout, but economically disadvantaged students. The subgroup includes some, but not all students who are eligible for school nutrition benefits. So included in the ED subgroup are students directly certified for free meals via SNAP or TANF, and students who are directly certified for free meals via other categorical eligibility, homeless, foster, migrant, runaway. Not included in the ED subgroup are students who are directly certified for free or reduced price meals via participation in Medicaid, or students who qualify for free or reduced price meals via household application. So now let's talk a little bit about the disclosure of information. So I'm going to go back to my browser for just a second. And then again, on this direct certification process website, we have linked to the eligibility manual. The eligibility manual is directly from USDA, and I hope that you all have this bookmarked on your own computers or know very quickly how to get to it, because it is the end-all be-all for eligibility guidance. And it has a lot of really helpful and useful information, including information about sharing our data. So we do have confidentiality requirements. So information provided by families on the household income application and obtained via direct certification can only be used for determining eligibility for meal benefits. In limited situations, children's free and reduced price meal eligibility information may be disclosed to programs, activities, and individuals as specifically authorized under the National School Lunch Act. And that is in Section 9B6 of the National School Lunch Act. It is in U.S. Code 1758B6 and regulations found at 7 CFR 245.6. Lots of references for these confidentiality requirements. So, for the disclosure information, the National School Lunch Act allows persons directly connected with the administration or enforcement of certain programs or activities to have access to children's eligibility information. So, federal education programs are allowed to get eligibility status only, and there's no prior notice or consent required for the child or the family whose eligibility status is being shared. For state education programs administered by a state agency or LEA, they are also allowed to get that eligibility status without prior notice and consent. And then LEAs for any other type of program. So that might be a fee waiver or participation in a different program. That eligibility information is not to be shared without parent or guardian consent with LEAs. So what this means is when you do data sharing for TISA purposes, for federal programs, there is no prior consent required, but if you're sharing it for other purposes, essentially the parent has to agree that they're okay with that information being shared. Now, I know this is a this isn't as clear cut when it comes to sharing this information, honestly, as it was when the eligibility manual was written. Because I realized at one point there was like a list and it was locked up in your file cabinet, and someone had to come get that physical list and to get and share that information. And in today's digital world, there's a lot more kind of just like automatic sharing of information. But I did want y'all to be aware of what you can use that information for. And I will also say, on that note, it is very important that the information and the raw files that you download from TMAC, there's a lot of very important and personal information. And so those need to be guarded and protected to make sure that there's not any type of data breaches happening. So that also is related to the disclosure requirements. So to recap, direct certification is a process. Not all students who are directly certified or who qualify for free or reduced price meals meet the definition of economically disadvantaged. For 30-day carryover, need to ensure that there is a local process to prevent the 30-day carryover eligibility from being reported to TDOE. And then you need to make sure that you have confidentiality and disclosure processes in place. So that means if there are people in your district who can access the data, they need to be aware of their requirement to keep that data confidential and under what circumstances they can and cannot disclose that information. What is an example of a state education program administered by state or local agency? I read that as basically like our TISA type, like the general LEA, like you're using it for the operation, the funding purposes of that. You're not using it for kind of like third party programs or information. Here is the QR code for today's evaluation, which Marlia is going to throw a link in the chat for. Okay, so we have a question that says, in what circumstances are Medicaid free and reduced needed for reporting? Also, before I answer that, here's my contact information, my email address, and my phone number. If you have any follow-up questions after today, you can feel free to reach out. I'm I I'm not entirely sure what you're getting at with in circumstances are Medicaid and free and reduced needed for reporting, and I'm assuming you're kind of asking why are we reporting that if it doesn't qualify us for TISA funding. And the answer is it is very good to have that data available. Because if there was ever any interest in expanding what that definition is, that is way beyond my control. It would be good to know where that stands and where that cost is. It's also important for us to know from a data matching and direct certification perspective to know if our participation in the Medicaid demonstration project is successful. Medicaid free counts towards CEP eligibility is another comment, and that is very true. I wasn't thinking of that from like a bigger reporting standpoint, but that is very important that Medicaid free does count towards CEP eligibility, and Medicaid free and reduced obviously provide benefits to students. I know there was a question about, is it possible to get the data of Medicaid free and reduced separated, especially for those of y'all that are operating CEP. And at this time, it is not. That could be something, a possibility for the system that we have in the future that you can sort and only download those free matches. Another place where our data is used is within federal programs and Title I. And depending on how your district determines the poverty level, Medicaid free and or reduced is included in those numbers. So that's another reason why it's really important. I'm actually presenting at the end of August to federal programs about our data. So if you have any messages you want me to make sure I get across to them, let me know. I'll be happy to try and share that information. Um, there is a question that says, if our attendance program can process the raw data from TMAC, is it okay to share that with them, or does it need to only come from us? Like, this is one of those things where it kind of depends on how things are set up at your local system. If you are providing them the raw data to make the matches, you need to make sure that they are aware of what that data is to be used for and the confidentiality requirements. Because I know some of y'all's like systems make the matches more on the attendance side. Some of you guys make the matches more on the nutrition side, and that's a very local level process type thing. So if that's how your local district is set up, I would just make sure that you have that discussion and agreements with them that they're not going to share the data for any reason that they shouldn't be accessing or sharing that data. I think I'm caught up on questions. If you guys have any more, or if I missed any, feel free to throw them in the chat. I see, Mandy, you have your hand raised. I'm not sure if we have the ability to unmute you or if you need to use the chat. Marlia?
Um, Mandy, if you're asking about your TMAC issue that you put in the Q&A, we already have emails in the works for you. Her her drop down isn't working in TMAC.
Oh, okay. That's weird. I see that was in the Q&A and not the chat. I'm sorry I missed that. But yes, we will make sure that we get that sorted out for you. Any other last minute questions? Jessica, I'm not entirely sure what your comment is related to about deleting things in TMAC, so we can follow up with you to get more information about that.
I just want to triple confirm with Mandy that we've addressed your TMAC concern to make sure you didn't have any additional questions.
If a student was on a June list for SNAP but is not on the July list, how can we carry them through the school year? And The answer is you can't unless you find them on the July list. And I know you're like, wait, how is that possible? They were eligible in June. Are they not eligible in July? And with the way that SNAP works, that is unfortunately a possibility. But Tina, is that which Tina is that? I can't see a name. I am interested though, Alcoa. Okay. I'll probably follow up with you as well to get a little bit of additional information on that scenario. Yep. As Frankie said, they are only good for the first 30 days of the new school year in that instance. So hopefully they will reappear. But like I said, I am a little interested in that, so we can do some follow up and kind of see how that is. And then I know that I said I would talk about migrant, but I will follow back up with you on that instead of now at the end. So there's a comment that said we had problems last year with applications that were approved for free meals and then Direct Cert kicked them off for reduced meals via Medicaid. So I think this situation was the student had a free application, an actual household application. And then they were directly certified, but directly certified for Medicaid reduced. And we know that free by application is higher in the hierarchy than reduced direct cert. That is a local software issue. So I think it is a good note for all of y'all to be aware and to double check that your software is applying the hierarchy correctly. Lisa, I hope you guys got that corrected, but if not, definitely follow up with me and we can talk about that. Any other final questions or comments? So there's a question about, would it be an audit finding if a TANF direct match overwrote an extended SNAP match? TANF is more beneficial to food service because TANF can extend to other household members, whereas extended SNAP cannot extend benefits to others in their household. I think there's a lot going on in this example that I would need additional information and to see what's happening, how those households are set up. I don't feel comfortable answering directly without having more information on that scenario. So, Eva, you can follow up via email if you want, and we can get some more specifics on that. All right, it is 2 o'clock Central Time. So if y'all have any other questions, comments, concerns, you can reach out by my contact information here. And if not, you will be getting a follow-up email from Marlia shortly. Thank you guys for attending today. I really appreciate it.